what to do if you are in your later third trimester and you find out your baby is breech or booty down. Well, first, this is a variation of normal. And prior to the year 2000, many midwives and OB-GYNs were trained in this art of delivering vaginal breech births. So if you're at all curious on what has changed and why, I would encourage you to watch the documentary Heads Up, and you can find that on informedpregnancy.com. One of my favorite colleagues, Dr. Elliot Berlin, and his team created this video. It'll give you some good insight as to basically where the shift happened in our history. Now, because of this shift in the year 2000, and this one study that basically influenced medical schools, trainings, etc., there are not as many providers that are trained in vaginal breech delivery, and certain schools no longer teach vaginal breech delivery. Hopefully, we're bringing it back with some legendary OB-GYNs and midwives that are keeping the art of delivering vaginal breech births alive. One person, one OB-GYN, one doctor that I would encourage you to check out is Dr. Stu Fishbein, and you can find his website, birthinginstincts.com. He's got tons of information on there as well. He does a lot of out-of-hospital births, and so as a result, it tends to be breech births and or multiples. All right, so what to do? If you have a singleton and you have a booty down baby, well, start like wrapping your mind around the possibility of, okay, I'm at a fork in the road and I either want to deliver my baby vaginally or I'm going to go a C-section route. So that's kind of the options, like that's the fork in the road of where you're at. Yes, babies can flip and turn head down all the way up until delivery, but if you're somewhere around 34, 35, 36 weeks, you might be presented with the options, maybe with your OB-GYN, of like, okay, do I do an ECV, or do I schedule a C-section, or you're with a midwife and maybe they don't do vaginal breech deliveries. So then you got to start thinking of other options. So we're at this fork in the road of vaginal breech birth or cesarean. Those are kind of like the main options that you're presented. And what I want you to do is go back to your intention. What is your intention around your birth experience? How do you want to feel? Because in this moment, this big fork in the road, I do not want you to make a decision out of fear. I want you to still, even though this is a big decision, I want you to make a decision out of love and not fear. This is a huge, huge decision. So right here, there's a ton of options we can start to explore. Now, if you're going the vaginal birth route with a breech baby, you might have to find a different healthcare provider. You might have to find a different OB. You might have to find a different midwife. And this might involve some digging in your neighborhood, in your community, in your city. I live in Austin, and we had a client, a patient recently, drive from Austin to Houston, which is like 2.5 hours away, to do a vaginal breech birth. So yes, options are limited. Some midwives still do this in certain areas. Some OBs do this, and they tend to be older OBs that are very artistically and skilled in this type of delivery. There are some legendary living legend OBs that are starting to bring this back into hospitals, like our favorite Dr. Cody Weiner in the Houston area. But yeah, options are limited. Now, if you are somewhere and there's no providers that want to deliver this way, then you might be stuck with a cesarean. And that's unfortunate, and I'm sorry. I'm sorry that that is where our world and our society is at, because that is like, you should not be forced into any decision. But there's still choices around this decision. And what I want you to think about and look up studies that Michel Audant has done. He's a famous French OB, and he's done research around cesareans and basically allowing baby to initiate labor, allowing baby to start labor and then show up for the cesarean tends to be the healthiest option for baby and for, basically everybody involved. That way you skip some of the drugs and medication involved. Baby has started labor, so they're telling you they are ready, and then you show up and for a beautiful cesarean. There are definitely some OBs that are like really supportive of that decision. So I encourage you to think about that as well and ask your OB, ask your doctor, like, hey, this is what I want to do. Like, would you be able to support me? All right, so a few things you can do on your own. If you are not getting chiropractic care, get chiropractic care. I need you to be getting chiropractic care as often as you can. So when I see somebody late-term pregnancy and they present with a breech presentation, I'm trying my very best to get them in the office 2, 3, 4 times a week if I need to. The other thing I'm doing is having them do movements and exercises after their adjustments and at home. There's another BIRTHFIT video for movements to support a breech presentation baby. So movements you can do at home to get yourself inverted, to get baby, in a more optimal position within your body and to set your body up with the best position possible. So we've got chiropractic, we've got optimal movements. Another thing I would encourage you to do is get in some water or a float tank or something that is like anti-gravity. That way you can relax all of this, right? And just breathe in those positions. Meditation and talking to baby, those are big ones. Meditation is so good for relaxing your nervous system. Talking to baby, let baby know that it's okay and it's safe to go head down. Or communicate with baby and say, hey, is there something that you know that I don't know? When babies aren't going head down, they're inside and they know something that we on the outside don't know. And that's okay. Babies know what's up. So those are the few things I would suggest. The last couple things would be an acupuncturist. Get with an acupuncturist if you don't have one. They can influence with certain needles and points and use things like moxibustion. They can send you home with moxibustion to stimulate movement. Another great website is Spinning Babies. They will have movements that you can do at home also. So be sure to check out the BIRTHFIT YouTube video for breech movements. You can check out Spinning Babies, get in the water, meditate, talk to babies, go to acupuncturists, and then trust that you and your baby know what's best. So make sure you're connected to baby and make sure you talk to baby. If you have any questions, let us know. We're here to support.